In a federal lawsuit filed last Friday, over a dozen Catholic plaintiffs argued that New York's Medical Aid in Dying Act compels them to counsel terminally ill patients on assisted suicide, refer them to participating providers, and host the procedure in their facilities. Here to unpack the details of this case is Alex Schadenberg, Executive Director of the Euthanasia Prevention Coalition. Alex, thanks so much for coming into the studio today.
Well, I'm very happy to be here today, yes.
So this law involves more than a dozen Catholic healthcare providers and religious orders. What specifically does New York's new law, which comes into effect on August 5th, require them to do?
So New York legalized assisted suicide, and one of the parts of the law is the requirement, there's several parts, but one is the requirement to inform people that they can have assisted suicide. So that's the first thing. So that they're requiring the sisters in Catholic healthcare to be complicit then in assisted suicide by informing. They also are required to refer. That's a whole nother issue. So therefore, if someone's actually asking to be killed by assisted suicide, they must do a referral. The final thing is this whole interconnection, though, with the financing through palliative care. And this is the next challenge that the sisters have put in to the law, that it requires this to be seen like a palliative care situation, which also then brings up the question of the federal law that forbids money going towards assisted suicide from federal money.
The state says healthcare providers can opt out of performing MAID. Why do the plaintiffs say that an opt-out is just not enough?
Yeah, so what the law says is that the sisters or the Catholic hospitals don't have to do the act, but they must then, as I say, inform, they must refer. So they're actually still required to participate, but they don't have to do the act. Well, you know, doing the act is bad enough, or being involved directly in prescribing lethal poison is bad enough, but to actually still have to refer or to inform is clearly a problem with a Catholic conscience, for sure, or with anybody who opposes killing.
What is at stake beyond this one New York law? Could it possibly be about cutting Catholic groups out of providing health care in the U.S.?
Okay, so these laws are definitely written by the death lobby. So the fact of it is yes, Catholic healthcare is being pressured out. That's what they're hoping. Or they want them to go into other areas which are, how would you say, less involved with the direct care of people. And I think that is important. And we see the same things just happen in France. France legalized euthanasia, and part of that law is affecting, for instance, the Little Sisters of the Poor have palliative care places in France, and they're saying that the law is requiring them to be involved by informing and referral also. So it's the same problem there, and they're saying they may have to leave France, these Little Sisters of the Poor. So it's the same concept. It's an international sort of organization to say, we're going to remove Catholic health care. Same problem in Canada. There's a whole court case over St. Paul's Hospital in Vancouver refusing to kill people by euthanasia.
So you travel around the world speaking on this issue. Is there any particular case that has surprised or shocked you?
Well, there's this recent case of an elderly woman who had originally said she didn't want euthanasia. She told the care home she was not interested. She said she was a Christian, wasn't interested. But then when the family went on vacation and was not around her because they were regularly visiting their grandma, the care home convinced her that this would be a good idea, and she then requested it. Now, she also had questionable competency, meaning that she had a level of dementia, but she was still able to respond to their questions. And so they declared her competent, they approved her death, and the family is shocked. The family is shocked. She has died. The family is shocked that how could you do this to our grandmother?
Do you think that they could take any legal action?
Well, the difficulty is with how the law is written. How do you take legal action? They can certainly go to the College of Physicians in Ontario and challenge what's happened, and hopefully that doctor would have a medical license question. They can also go to the coroner's office. But the law is actually designed to give these doctors total legal protection when they're involved with euthanasia or assisted suicide, which is not different than the Oregon, Washington State, New York laws, etc., which provide total legal protection to doctors who are willing to kill. And to be very clear, I'm not opposed to euthanasia because of these terrible cases. I'm opposed to euthanasia because I'm opposed to killing people.
We appreciate your work and, of course, especially for coming into the studio today. Alex, thank you so much.
Thank you.